Hello everybody. This presentation is going to be about fear of pain, injury history, and exercise habits among college students, and is based on a study and prior research by Dr. Kaitlynn Smith. So the fear avoidance model of pain was developed by Vlane and Linton in 2000, and it was developed to describe the pathway that occurs when individuals with chronic pain experience an injury. So you'll see that on the left side of the diagram, it kind of goes in a big circle. So generally, after experiencing an injury, a person with chronic pain will obviously feel the pain, and they may begin a process called pain catastrophizing, which is essentially cognitively and emotionally distorting the painful experience so that it seems overwhelming and the person may have trouble coping with it. And then this may lead to sort of an enhanced fear of pain and painful experiences, which will lead to hypervigilance and avoidance of potentially painful experiences in the future. So avoidance of painful activities may then lead to disuse and a lack of engagement in physical activities such as exercise or just other activities in general that would help the individual to recover from the injury. So then on the right side of the diagram, you'll see that if the individual does not have fear, so they don't have that pain catastrophizing, the over worrying about the pain, in the absence of that worry, then they will actually confront the pain and continue to do the experiences such as exercise and different activities, even though those activities may be causing them pain. And in the long run, this is associated with better outcomes and better recovery. So individuals in the left side will experience a lot of negative affect, so maybe depressed emotions or anxious emotions, and may perceive painful experiences as threatening. So this left side is associated with worse health outcomes and poorer recovery. Again, this is designed for patients with chronic pain. So I want to go into the background of fear of pain for a little bit. So fear of pain is a defense mechanism in response to a threatening stimulus. So the fear of pain is an anticipation or an expectation of pain, and it increases avoidant behaviors of the stimuli that are associated with pain. So fear of pain also triggers protective behaviors such as sympathetic nervous system arousal and the fight, flight, or freeze response, and again, avoidant behaviors. The fear avoidance model was designed to explain the development or maintenance of chronic pain versus recovery, chronic pain and avoidance encompassing that left side of the model, and recovery and confrontation taking up the right side of the model. So potential resilience pathways have been found which encompass the right side of that model there, which involves the confrontation of the pain rather than avoidance of it. So in summary, avoidance of potentially painful stimuli is associated with worse health outcomes and worse recovery outcomes, and avoidant behaviors may actually not be adaptive to overcoming pain and fear of pain. Previous research by Kaitlynn Smith discovered that fear of pain is associated with certain cognitive constructs such as perceived benefits and perceived barriers for physical activities. So a perceived benefit could be something like the person sees their ideal body image and they want to pursue that. So getting that ideal body would be a benefit of exercise. Whereas a barrier to exercise might be something like a health condition, maybe like asthma, or something along those lines, maybe a work schedule that just wasn't conducive to being able to get that physical activity in as much as they would like to. So benefits and barriers both predicted levels of physical activity, but they were different for men and women. So this diagram here shows the initial fear of pain response, and then the top part of the diagram shows how women responded, and the bottom shows how men responded. So for the top portion, when women perceived more benefits to exercising, they actually exercised more and engaged in more physical activities, and they spent more days of the week doing physical activities. Whereas for men, the less anticipated pain they expected from these physical activities, the more likely they were to engage in activities, and the more days of the week they spent engaged in physical activity and exercise. In the fear avoidance model of pain, which we looked at on the second slide of this PowerPoint, the cycle begins with the onset of injury. So whether the cycle constitutes that pain catastrophizing and the worst recovery outcomes, or the other half, which was the resilience pathway, it all begins with the onset of injury. So the goal of this current study was to investigate the impact of injuries that are obtained through an exercise or activity. The first hypothesis was that injury would be associated with fear of pain. So if you've been injured, you'll be more likely to have fear of pain. The second hypothesis was that injury history would predict frequency of exercise, so that if an individual has multiple injuries in the past, they would be less likely to engage in physical activities and more likely to engage in avoidance behaviors, which would be the left side of that fear avoidance model pair. Participants for this study consisted of 162 undergraduate students enrolled in general psychology courses. As you can see, just over half of them were female, so 59.3%, and the majority were Caucasian, 80.9%. The mean age was 21 years, and nearly half the participants reported that their overall physical health was either excellent or very good on a 5-point scale. After giving informed consent, participants attended a testing session to fill out a questionnaire packet. This packet consisted of a variety of questionnaires, which I will go over in a moment. Participants were also asked to specify in open-ended format their worst injury that was a direct result of participation in an exercise or sports activity. The first questionnaire pack was the fear of pain questionnaire, which gave examples of activities that may be considered painful, such as breaking an arm or getting an injection, and participants were asked to rate on a 5-point scale how afraid they were of this activity. The second was the physical activity benefits and barriers scale, which measured benefits and barriers that participants may associate with physical activity. Next was the physical activities survey, which asked participants about a variety of different physical activities and how frequently they engaged in them. Lastly, participants filled out a depression scale, which measured depressive symptoms and negative affect. Participants were informed they could skip any items they wished to or quit the survey at any time. Based on the open-ended question about injury history, we found that 70 participants reported having an injury resulting from a sports or activity, and 93 reported no injury. 32 reported a single injury, while 37 reported 2 or more injuries. Independent t-tests were conducted for the presence or absence of an injury in predicting fear of pain and physical activity. The results for the fear of pain t-test was found to be negative 0.47, which is not significant. However, for the physical activity t-test, we found 1.83, and the p-level was 0.069, which is considered marginally significant. ANOVAs were also conducted for injury history in predicting fear of pain and physical activity. For the ANOVAs, for fear of pain, we found 2.18, which is non-significant, but for physical activity, we found 2.78 and p-level at 0.65, which is also marginally significant. These results suggest that in this study, fear of pain was not related to injury history. However, physical activity was related to injury history. Based on the pattern of the data of injury history being related to the physical activity survey, researchers decided to investigate whether the injury variable was related to cognitive constructs that may predict activity levels. Control variables included gender, age, and overall physical health. The results of this study run contrary to our hypotheses. The number of injuries was positively related to perceived benefits of activity, which was related to the physical activity survey score, and then related to activity level in general. Number of injuries also directly predicted the activity level or days per week that participants engaged in physical activities. These results, in short, suggest that the more injuries participants reported having in the past in relation to a sports or exercise activity, the more benefits they perceived and the more activity they engaged in. The results of this study ran directly counter to our initial hypotheses. We found that number of injuries was positively associated with higher activity level and perceived benefits of activity, and we did not find that injuries were significantly associated with fear of pain, as had been shown in previous research. One potential explanation for these findings may be that the participants in this study consisted of healthy individuals, while the fear avoidance model of pain that we based our research on focuses on individuals suffering from chronic pain. It is possible that individuals suffering from chronic pain and individuals who do not suffer from it may respond differently in light of fear of pain and in light of injuries. Healthy individuals who have experienced an acute injury, such as during a sport or exercise activity, have a much faster recovery time than those who experience chronic pain symptoms. Thus, it is possible that the short duration of injuries obtained through activities such as sports and exercise may cause these individuals to not fear pain as much as individuals who suffer from it on a daily basis. In addition, our injury question focused solely on injuries that were obtained through participating in exercise or sports activities. So it is possible that injuries obtained through a non-sport or exercise-related activity may produce a different response in terms of fear of pain and physical activity. There are several limitations to the current study. For one, though our sample size consisted of 162 participants, only 70 of them reported having an injury related to a sports or exercise activity. Thus, the sample of individuals who had obtained an injury through a sports or exercise activity was relatively small. In addition, because our question about injury history focused exclusively on exercise and sports injuries, it's possible that individuals who are frequently engaged in these types of activities may respond to pain and to fear of pain differently than individuals with chronic pain. Future research could investigate whether individuals who are frequently engaged in a sports or exercise activity, such as athletes, may respond differently to pain and injuries than individuals who experience chronic pain or individuals who are healthy but do not engage in high levels of sports or exercise activities. For example, it's possible that athletic individuals may have a different approach to fear of pain or experiencing an injury. Many sports and exercise programs encourage less avoidant behaviors and more confrontation of pain and injury, as well as increased levels of physical activity despite potential pain or injury that may be associated with that activity. This may have impacted our study results, and further research is necessary to determine whether our findings are best explained by this approach. I worked on this project as an undergraduate research assistant for Dr. Kaitlynn Smith during the spring of 2021, during which time I coded and organized injury data from the previous study that Dr. Kaitlynn Smith had done. I would like to thank Dr. Kaitlynn Smith for taking me on as her assistant and letting me get more experience in the field of research. I would also like to thank KSU Stark for offering the URA program, especially during these times during the pandemic. The assistantship has been a very good experience for me this semester, and I hope that others continue to benefit from it in the future. Lastly, I would like to thank the viewers for watching and listening to my presentation today. Thank you.